First rule of having the talk with your child, it's not a single talk. It's a huge myth that children need to have one huge conversation about sexual and reproductive health. After all, in one itty-bitty conversation, how could you possibly talk about fallopian tubes, semen, vas deferens, the IUDs, consent, pornography? Obviously you can't. Don't expect yourself to be able to do this, and don't expect your child to be able to sit through all this. Instead, pepper conversations about sex throughout children's lives as they grow and change. It all begins when children are really small, so you can start by using bath time or diaper changes to say, "Where's your elbow? Where's your penis?" Babies and toddlers are not too young to know the correct names for their body parts. And it's much easier to start using them when your baby is 1 versus when they're 16. When children are preschoolers, it's a great time to start talking about the basics of birth and pregnancy. Many small children really want to know where they come from, and it's a great time because of course they may be having siblings born or watching new neighbors come along. Again, children aren't too young to know that babies grow in wombs or uteruses, or that when it's time to give birth, the baby comes out through the vagina or through a special incision during a C-section. Don't feel like you have to go into very complicated, detailed explanations. Sometimes a simple description will be enough and your child will be on their merry way. You may be sweating bullets while a child just wants a brief explanation. They won't understand everything necessarily, and they don't have to. They'll ask more questions later when they need to know a bit more information, especially if you make it clear that you welcome these conversations. Tip: when you're describing pregnancy, resist the urge to use terminology and words involving the stomach. When you tell children that babies grow in stomachs, they get everything confused. Sometimes they think that you eat babies and then poop them out, and talking about sexual health becomes a lot more complicated in that situation. Meg Hickling, a Canadian sexual health educator for kids, suggests that children need to stretch their knowledge over time, rather than trying to absorb everything at once. So chances are it could be several years before your child asks how babies are made or how do they end up in the uterus. And of course, if they don't ask it, you can always start the conversation yourself. If you're really nervous about what to say or how to say it, go to a library or bookstore and find books on the topic. There are a number of age-appropriate books that do all this for you. And of course, they're written in an age-appropriate language with age-appropriate illustrations. And reading one of these books to your child at bedtime is a great way to talk about the facts of life. It's a quiet time for questions and reflections. It's also a really great time to point out to your kid that these questions and conversations are not appropriate for the grocery store, but for these quiet times. Sometimes we assume that we should let children ask questions before we talk to them or tell them anything about sexual health. Some kids will ask lots of questions. Other kids will think that the silence means that sexual health is a topic that you can't talk about ever. So, as awkward as it is to start a conversation about sexual health with your child, just imagine how difficult it might be for that child to start a conversation with you, especially if they think that sexual health is a topic they're not allowed to talk about. And trust me, at some point, all children will have questions about where they came from, how they were made, puberty, and about those different feelings and relationships that arise at that time. If you're nervous, that's completely natural because many of us didn't grow up with honest conversations about sexual health. Be honest with your child and say that you're really nervous to bring this up because you never had the opportunity to have these conversations growing up. Not sure how to answer a question? Again, that's okay. Just be honest with your child and say that you need some time to look up an answer or you need a little more time to think about it. Perhaps the two of you could even look up the answer together. You'll be teaching your child that it's okay not to know everything and that it's okay to learn more about your sexual health. So if you need any more information, visit your local library, sexual health center, or talk to your healthcare professional. And good luck.